Today we're going to talk about expectations after surgery. You should expect to spend one night in the hospital or a 23-hour observation period wherein you will be well cared for by medical staff. Once you meet discharge criteria from the facility, you'll be wheeled out and released into the care of your loved one. Upon discharge, please confirm when the last dose of pain medications were given, as you will pick up where they left off. You should also begin taking your Xarelto blood thinning medication the morning after your surgery. Please confirm if the facility gave you this before you were discharged. As a reminder, you should take 2 tablets every single morning with breakfast for the first 10 days after discharge. Continue until the bottle is all gone unless otherwise instructed by your physician. This is a mandatory medication and not optional. If not taken as directed, it can result in flap complications. If you have any issues in obtaining this medication prior to surgery, please call our office. We encourage a loved one to stay with you while recovering for the first 10 days after surgery. During this time, please arrange for someone to drive you to your first post-op appointment, which is usually approximately 1 week out from surgery. While you recover, you will need to get rest, but not be on complete bed rest. You will be expected to engage in light indoor walking for 10 minutes every 2 hours during the daytime. If you have compression stockings, these may be removed once you are able to ambulate every 2 hours. Do not lie down flat, as this will put extra tension on the abdominal incision. Keep your head elevated, as this will reduce swelling. You may do this by placing pillows or a wedge pillow under your back and your knees in bed. If available, you may also sleep in a recliner. Do not stand fully upright. This can put tension on the abdominal site, which can affect wound healing. You'll walk hunched over for about 10 to 14 days after surgery. You may then ease into an upright position. Do not apply heating pads or cold packs unless instructed by your doctor. Do not apply any type of compression to the breast, such as a mastectomy bra, sports bra, or compression bra. We will tell you what to wear and when in the upcoming appointments. Please avoid smoking or being around those who do, ideally for 6 weeks before and after surgery. Not doing so can greatly impair your ability to heal. Do not engage in any stressful activities. Do not lift, push, or pull anything greater than 10 pounds for 3 weeks after surgery. Do not lift your arms above shoulder height, but please lift to shoulder height to prevent them from becoming too stiff. Now let's talk about your post-op diet. You should consume at least 8 ounces of fluid every 2 hours, preferably water. Avoid alcohol and caffeinated beverages. In terms of food, you should follow a high protein, high fiber, and low salt diet. This means to avoid soups, electrolyte drinks, and processed foods, as these are all high in salt. We encourage patients to consume 1 Nestle Advanced Recovery protein drink per day in the immediate post-operative phase, especially if you have recently finished chemotherapy. Boost, Muscle Milk, and Ensure protein shakes are also great options. What to expect 2 to 7 days following surgery. Your pain will decrease and your strength will improve with each passing day. Ease into your daily activities slowly and maintain walking. You may resume driving once you are no longer taking narcotic pain medications. However, make sure you're capable of making all the driving maneuvers with your arms. You may shower 48 hours post-op. Do not take a bath or submerge your wounds in any body of water, hot tubs, pools, rivers, lakes, or oceans. For your first shower, you should allow the water pressure to hit your back instead of your breast and your abdomen. Use antibacterial soap and water to wash over all of your incisions and your paper tape. You should then rinse off your antibacterial soap and pat your skin dry. There is no need to reapply gauze or bandages that might otherwise cover your closed incisions. It may be helpful to put your JP drains on a lanyard when showering so your hands can be free. Your paper tape will either fall off on its own or be removed at 2 weeks post-op. Try to have a bowel movement 1 to 2 days after surgery. You may need to add Miralax or milk of magnesia if you are not having results. If you haven't had a bowel movement by day 5, please contact the office and call for further intervention. Above all else, listen to your body. Begin shoulder shrug exercises daily to help prevent upper extremity stiffness. 2 to 4 weeks following surgery. At this point, you will start easing into your normal daily activities. Continue to wash your incisions daily with soap and water. No twisting or lifting anything over your head. You may begin to wear non-compression and light chest support garments, such as bralettes or camisoles. Do not wear anything constricting or an underwire bra, as this can affect blood flow to the breast flaps. Starting 2 weeks after surgery, you may then begin to sleep flat and stand upright. This is as long as you do not feel like it's putting too much tension on your abdominal incision. Between 4 to 6 weeks after surgery, you may ease into your regular exercise routine. Please be mindful that as you have not been active the last few weeks, it may take some time for you to regain strength. Please listen to your body and do not overexert yourself. Let pain be your guide for your limitations. 6 weeks following surgery. Healing will progress and your breast and abdomen will settle into a more final shape and position. Please ensure you have a 6-week follow-up appointment scheduled, and if not, go ahead and call our office to do so. You may ease into your regular fitness routine without restrictions. However, realize that your upper body may require some additional time to return to your prior strength. You may resume wearing all bra types, as gentle support is encouraged at this time. It is okay to resume sexual activity. Practice good sun protection. Do not expose your incisions to direct sunlight. Your chest region and donor sites are highly susceptible to sunburn or the formation of irregular, darkened pigmentation. At this point in your healing process, you'll begin to discuss the next stage in your reconstruction. Typically, this is scheduled 3 months after your DIEP surgery. If no further surgeries are indicated, you may begin a silicone-based scar therapy to your closed and healed incisions. What to expect your first year. Practice a monthly self-breast examination. Depending on the type of mastectomy you had, your breast surgeon will direct you for your annual need of imaging of the breast, ultrasound, or mammogram. Your scars will continue to refine for up to 1 year after surgery. If they become raised, thicken, or appear to widen, contact our office. Your body will change with age and fluctuations in weight. The appearance of your breasts will change too. You may wish to undergo revisionary surgery again in the future to help maintain your appearance throughout life. Contact our office with any of your questions or concerns at any time. And again, thank you for entrusting us with your care.